Hey there. I just wanted to let you know that next week I will be offering a free live VBAC prep workshop called Three Steps to Have an Empowered VBAC, even without a supportive provider. The two sessions will be on Wednesday, October 9th at 12 p.m. Eastern Standard Time. The second session is Tuesday, October 15th at 2 p.m. Eastern Standard Time. You don't have to attend both. You can attend either one, or you can attend both if you'd like. Again, this will be live. Some of the things I'll be covering in the workshop are how to shift from fear and doubt to confidence and empowerment when it comes to your VBAC, the power of effective communication and boundary setting, and how you can still have a strong support system even without a supportive provider. This workshop is perfect for anyone, whether you're trying to conceive or currently pregnant and preparing for a VBAC. Again, the two dates currently being offered are Wednesday, October 9th at 12 p.m. Eastern Standard Time and Tuesday, October 15th at 2 p.m. Eastern Standard Time. If you want to find out more and register for one of the workshop dates, please go to thehannahgill.com/workshop. Hi, everyone. Today's guest is someone I know that a lot of you have been waiting to hear, and that is Katie Spinks. You may have seen or heard Katie's viral story on TikTok or Instagram. Katie had a uterine rupture without a previous C-section or any other uterine surgery, and it left her and her daughter with severe complications. Katie went through severe birth trauma and medical negligence in 2020 that left her daughter permanently disabled and her without a uterus. She spent the last 3 years educating and informing women on safe birth habits and the risks that come along with using Pitocin. She also is a support system for other special needs families. I'm your host, Hannah Gill, and this is Motherhood Flow. All right. Hi, Katie. Welcome to the show. So happy to have you here today.
Thank you. I'm glad to be here.
So I'm going to have you, if you can go into your birth story, tell us the main timeline of what happened with everything and how that played out.
Okay, so I had a 39-week induction on January 1st. It was a Pitocin induction. Again, I was 39 weeks. It was elective. So I went in, everything was fine, and then it wasn't. I started feeling some agonizing pain in my abdomen. So I called my nurse and told her that I was in some pain, and she gave me some, I think it was Stadol. It was through the IV. It didn't help. I called her back in again 15 minutes later, told her it was progressively getting worse and it was really painful. And she just kept telling me, like, this is labor pain. You should be used to this. You've had 3 other children. You're just going to have to just work through it. So I want to say like 30 minutes goes by and I call her back in and I'm like, there's something wrong. Like I kept trying to communicate with her that something was wrong. And this goes on for about an hour and 48 minutes. And then a doctor comes in, the on-call doctor, and she tried to deliver me vaginally with a vacuum, but it didn't work at all. And I ended up needing an emergency C-section because my uterus ruptured. The reason why they called the stat C-section was because I passed out from blood loss, not because of my daughter's stats. Like my daughter's stats were really, they were scary. Like they were her heart rate was between like 40 and 60. It was about 47, 48 minutes. But they would not do the C-section until I passed out. So they did that. And it took about 3 hours to fix me up, give me blood. And when I woke up, that's when I found out that I had the uterine rupture and she needed to be revived and that she was transferred to a different hospital than I was.
Okay, so did you have an epidural at all during this process?
Not for this one.
Okay, so you definitely felt, because a lot of women, since I primarily work with the VBACs and uterine rupture as a concern,
Mhm.
they say they'll still feel pain
Oh,
like
yeah.
between epidural, even with their epidural, they'll still feel the pain between
Mhm.
contractions. So without an epidural, you probably really, really felt it.
It was the worst pain I've ever felt, but I've heard that too, that even with an epidural, it doesn't matter. You still feel a pain because, it's not like related to birth and contractions. It's not your cervix dilating. It's like an actual organ in your body, like literally exploding.
Yeah.
So yeah.
Did you, so you had three other children. I just want to mention for everyone, you did
Mhm.
not have any cesarean or any sort of uterine surgery prior to this.
No, I had no scarring, no surgery, no nothing. My uterus was completely healthy. I had a healthy pregnancy, healthy baby. I was healthy. I had 3 vaginal births prior. There was no indication that something catastrophic would happen prior to it happening.
And were you induced with your other births at all, or were those all spontaneous?
My first one was an induction. My second one, I received, I want to say like 2 doses because I was already 4 to 5 centimeters dilated when I got to the hospital. And my third one was an induction.
Okay, so you received Pitocin pretty much for all the births prior.
Yes.
Did anyone ever mention uterine rupture as a potential risk for
No,
Pitocin use?
I didn't even know that was a thing. I honestly didn't know that Pitocin was dangerous at all or
Mhm.
had any risks every time I received it. This is just a drug that'll help you get moving. Your body already produces it. It's fine. Nothing's going to happen.
Mhm.
Nobody ever even slightly mentioned that there were any risks. So I just thought that it was safe. I
Right.
never knew anything about it.
And did you, prior to any of your pregnancies, did you take any sort of like childbirth education class at all? And if you did, I'm assuming that the risks were not mentioned.
I did not. I didn't
Okay.
take any of them.
Okay. Um, because I don't believe it in any of the classes I've ever taken that Pitocin risks were discussed ever. So,
Yeah, I don't hear anybody saying anything about that either because
okay.
I've like, I talk about it online. People always say that they take the classes, they do everything, they say they do everything right, and nobody ever mentions it.
Hmm. And obviously it's not, I mean, it's not really possible to, unless you have like the insert for the medication being used to look at every single risk. Like your doctor is not going to do that in a 15-minute appointment or whatever, but it still should be
Yeah,
discussed before use.
absolutely. Informed consent should be the only consent, but we're
Yes.
not receiving that at all. Even just mentioning it, like, hey, Mrs. Smith, I just want to let
Hmm.
these are the risks that come with Pitocin. I'm not saying it's going to happen. I'm just telling you that it could, and I want you to be aware, just in case maybe you feel off. You can, go down the list, like just
Hmm.
something so that we're aware. But with not knowing, we're just associating all the pain with, normal childbirth. People think that it's normal, but
Hmm.
it's not.
And like a lot of people who have been induced or are going to be induced are told like induction can make labor more painful, but
Mhm.
if they're not mentioning the risks that these are things that could happen, then you could change your mind about an elective induction if you would have known that. I mean, you don't
Yeah,
know like
absolutely.
how that would change your decision.
Yeah, if I had known that there were any risks, so like I said, I was told there were no risks. If I had been told any of those things, or that even fetal distress was a risk, I would have been like, let's decline for like another week or two. Let's just see what happens. Like I wasn't having any issues. I really didn't need to be induced.
Hmm.
39 weeks really isn't a need to be induced. I could have definitely waited had I known that there were
Right.
risks.
Especially having like a healthy pregnancy without like major preeclampsia or something like that. Like
Yeah.
they're just an elective induction and I know we both know, some of our listeners might not
Mhm.
know that there is on the FDA website like a black box warning against
Yeah.
Pitocin use for elective inductions without a medical necessity. So,
Yeah. I've even read to the NIH, they do not recommend like unnecessary intervention, that you should
mhm.
only intervene when intervention is needed, not just because it's there.
Right, right. And so after your birth, you said your daughter had to be revived and everything. Like what did it look like after that?
Um, let's see. So they woke me up before they transferred her because when I woke up, she was already in the transport cart in my room. I had like less than 30 seconds to say hi and bye to her. So it was really scary. Everything that was done over the phone through like FaceTime because, like I said, we were in 2 different hospitals. So I had just learned that I had a uterine rupture and that she went quite amount of time without oxygen to her brain. So she suffered a severe brain injury. So she went to another hospital. She was cold for 3 days. She was having seizures. So they kept her really sedated. They kept her on phenobarbital, kept her body comfortable. And she stayed there, and I stayed where I was until like day 3, day 4, maybe. I want to say it was about day 4 when they took the catheter out and they let me have like IV, or not IV, oral pain meds. And then I just went up there to be with her to, just start the whole process, just to figure everything out. They did do an MRI the day that I got there. And that's when it showed that her entire brain had suffered a severe injury. She had bleeding on 2 different parts of her brain. And they said that she more than likely was not going to wake up. Because while she was she wasn't in a medically induced coma, but they were keeping her sedated because she was on the vent. She was being cooled. She was having all these seizures. But she also was not like showing any signs of life. Like she wasn't moving her hands. She wasn't blinking. She wasn't moving her feet or anything like that.
So, did you end up having to have an emergency hysterectomy with your C-section, or do you still have your uterus?
They did not take my
Okay.
uterus. I did eventually have to have a hysterectomy because of my bleeding and my pain, and I got pregnant 2 more times after her, and both of those I lost due to preterm complications with my uterus. So eventually, my doctor was like, You have to get your uterus out. You can't keep going on with your uterus in you. It's going to cause nothing but complications. So I did get it taken out.
Okay. So it I'm assuming that those complications with your future pregnancies were probably from the rupture and how the state your uterus was in. So it's
Exactly.
they probably, I mean, could have it taken it out at the
They
time,
should
but
have.
yeah,
They should have.
yeah.
They should have just taken it, honestly, because there's just when it was taken out, the doctor took it out so that it was just so scarred and mangled that eventually it probably would have ruptured again for no reason at all. He said you could
Hmm.
have just started a period and ruptured. He said it was just very in a very fragile state, that
Yeah.
they should not have let me go home with it. They should
Hmm.
have just taken it out.
Yeah. And that is even something that can occur as like spontaneous rupture without
Yeah.
induction too. Obviously, that is extremely rare
Yeah.
for your uterus to just spontaneously rupture, but we know that it can happen, which a lot of women don't realize. That's just one of those very rare complications of pregnancy and stretching of the uterus.
Mhm. Yep.
So how did you handle? It was probably a lot to absorb and process at that time. So how did you handle like the emotions and the anger that came along with like how you guys were treated through that whole process and like what ended up happening?
It was really hard. It took years to really like sit down and kind of like face reality, like I just kept masking every emotion that I had. I would just mask it with something like staying busy, doing this, doing that. Like when she first was in the NICU, I masked it with painkillers because my doctors just kept giving them to me, give them to me, give them to me. So I did that for about 6 months. And then when I stopped, I found other things. Like I would mask it because if I felt the emotions, I felt like I was going to break, like it was really hard to deal with. I can't even put it into words. Like the feelings that I felt. It was so much. It was anger, it was sadness, it was stress, it was let down, it was everything. It was everything. So I just masked it for a really, really long time. And I refused to like think about it, to feel it or anything. And then one day I just got really tired of it. Got tired of masking. Got tired of whenever somebody would bring it up, I would just get mad. So I just like sat down one day and I just like I talked to myself, to be quite honest, like because I
Hmm.
tried therapy. I didn't like it. I didn't feel like it did anything. I
Hmm.
tried groups, I tried meds, I tried all sorts of things. Nothing helped. I just had to like sit myself down and make myself realize like this is reality. This happened. You can't change it. You can't mask it. You can't take it back. This is your life. You can't change it. You can't do anything about it. You either have to face it and deal with it, or you're going to crumble and you're going to fall and you're just going to be sad for the rest of your life. So eventually, once I started like thinking about it more and like talking myself through it and going through everything that happened and just pretty much just facing reality, is when I started to let go of the anger. Um, like before I did all that, I hated them. Like every time I would drive past her office, that doctor's office, I just wanted to go in there and do terrible things. Now when I pass it, I don't care anymore. Like she did what she did to me. I can't take it back. she clearly doesn't care. She probably will never care. So holding on to all that anger is really just going to wear me down as a person, a mom, and a caregiver.
Yeah.
So it took some time, but I had to just work through it with myself to let it go.
And did you ever have, because I know for my traumatic birth, I had intense feelings of guilt, like I should have done something
Mm-hmm.
differently or made a different choice, or it was my fault and my body was the one that messed up. Did you ever have any feelings of like like guilt surrounding it, even though it was obviously at the hands of a lot of it was at the hands of like
Mm-hmm.
incompetent providers basically
Yeah,
and like people that didn't support you, but did you ever feel any guilt from it?
I did, and I still do. My guilt has not lessened at all, even though I know, like the logical part of me knows there's nothing I could have done to prevent it. I didn't do any of this. Like there is zero part of me that caused this, and if I knew it was going to happen, I would have just stayed home. But I do feel guilty because like weeks leading up to it, I kept having these like really vivid dreams. Like I had these weird dark feelings that something bad was going to happen. And I told my doctor, and he was like, "You're just nervous. Like you're gonna have three. You're gonna have four kids. The transition from 3 to 4 is really hard. Like everybody gets nervous. Like I just kept having these feelings that something bad was gonna happen, and I feel guilty for not listening to it. Like again, I just thought it was nerves and all that. I just feel guilty that I didn't research inductions or pitocin on my own. Like I could have done that. I should have done that, but I didn't. So I harbor guilt for the not researching inductions and Pitocin on my own, and two, not listening to those feelings that I received prior to her birth.
Mhm. And I mean, the fourth time around, you probably thought, well, I've had Pitocin 3 times, so you probably didn't even
Yeah,
second guess it. And
no.
and it's really interesting that you mentioned like those feelings leading up to it, because there was actually another birth story that I had listened to on a different podcast of a mom that experienced an amniotic fluid embolism. And she said and that's extremely, extremely rare.
Yeah.
And she said leading up to her labor as well, like she just felt like this dark like sense of like knowing
Mhm.
like something is going to happen to me. Even and so much so that like while she was still pregnant, like having those feelings, she arranged for like emergency surgeons to like she like had like this feeling like she's like something's gonna happen to me during my birth. And she like arranged all this stuff ahead of time. And it did like something bad did end up happening. And she's she said like at one point she felt like she manifested it, but she just had like these like just intense feelings of
Yeah,
like
no, I get
something's
it.
yeah.
I had those too. And I even wrote a will in my friend's kitchen. Like on Thanksgiving, it was about 5 weeks before Jolene was born. I was like, I feel like I just should make a will. These feelings, I feel like it's something telling me that something is going to happen to me. And if I pass away while I'm having my daughter, I don't want to leave my kids with like nothing or not knowing. So I wrote them all letters and I wrote out a will. Like I did all these things. I thought something was going to happen to me.
Yeah, and I
But
feel like and that's such like a dark like morbid thing, but I feel like a lot of women just they're scared of birth in a way that like I could die. So what do I need to do to like lessen the blow on my family if that does happen?
yeah,
And that's such like an awful thing to think about, but
it
it,
is.
and especially for like first time moms, I don't think about that as often, but when you have other children at home, that is something a lot of women are fearful of, and it's unfortunate that we even have to have that fear in place.
Yeah. It is. It's scary. It's scary. And to think about like leaving your kids behind is terrifying in itself.
And I think that's one reason why so many women have to work through a lot of fears in pregnancy, like leading into their birth, to just really surrender to the process and know that it's the majority of it is out of their hands. And they
Hmm.
just have to surrender to that. And um, do you feel like you still so as far as like the hospital staff, I've like looked at your videos online and stuff, and a lot of people are like, well, why didn't you like file a lawsuit? Why didn't you pursue legal action? And that's something I know a lot of people bring up. And for me
Oh yeah,
personally, I have a family member that went through a medical malpractice suit, and it took years and it was exhausting. And
exhausting.
and my family member still lost. Like the doctor was not found to be at fault. So how
Mhm.
do you personally like feel about that? Like people coming at you, like, why didn't you file, if they were really negligent, why didn't you file a lawsuit against them?
I have mixed feelings. So there's always, I separate those people into two different groups. There's the people who read my responses or listen to my responses and they get it. They're understanding, they're just empathetic. They're just there to listen, And then there's the people who are like naggy, kind of like chihuahuas. Like they just keep spewing and spewing and spewing. And it's like, if you've never been through this, all you can really say or are your opinions. Like you can't say I would do this and that unless you've truly been through it because you really have no idea what you would do unless you've been in the situation before. And we tried to file a lawsuit, but she falsified my records so hard that there's nothing. My lawyer was like, unless you can give me a video, some pictures, something to prove your story, there's literally nothing I can do for you. And because we wanted an intimate birth, just me and him, just have our baby and go home, we had no video, no nothing. We had no electronics in there. So there was nothing to prove our story, even though all of her injuries match up with it. With a medical malpractice suit, you really have to dot every I, cross every T, and you have to be able to prove it and more. And even then, if you prove it, they can still say, I'm not guilty. Like we've already filed a lawsuit. Something completely unrelated happened to her when she was 7 months old. And we did file a lawsuit. It was so cutthroat, like that it was somebody else's negligence. But they still said that they were not guilty. It still took so long to fight. Like people just don't understand a medical malpractice lawsuit is not like the movies. You don't
Yeah.
just go in and say, Dr. Smith hurt me by doing this. And the lawyer's like, okay, here you go. Here's your check for $4 million. Like, that's just not how it works. It's very exhausting. You literally have to put yourself back in that vulnerable, traumatic event. You have to relive it. You have to sit there and tell that story day in and day out to so many people. And it just, if you're already suffering from it, it's just like another knife in your back. It's really emotionally exhausting. And in the end, it's just, what do you gain from it? A couple bucks, like, is buying a new house really going to take away all your trauma? Is going on
Right.
vacation really going to take away your trauma? Is buying a new car going to take away my daughter's brain injury? No, none of that is going to do everything. So then that's where the people come in where they're like, the money, the money. Well, like luckily for us, I don't know about any other state, but we live in Virginia. So Virginia takes care of their special needs families so well. Like she has Medicaid. So we don't pay a dime for medical. They even like reimburse for gas. I get paid to be her caregiver. Like she has all of her seating covered. So like, we don't pay anything for medical. So that way I can focus more on her and her needs and what she needs. And then also being there for my other kids as well, rather than sitting in a lawyer's office every day trying to fight for a couple dollars. It's just the emotional part of it for me was not worth it. We tried twice. And once that second lawyer was like, unless you can physically give me proof, I can't help you. I was like, I can't do this again. Like I can't keep
Yeah.
doing, I'm already suffering mentally. I can't keep doing this to myself. I'm going to end up in a hole that I can't get out of.
Yeah. And sometimes you need that peace more than
Yeah.
more than you need money. Like,
Peace
yeah.
is so much worth more than $1 million. Like you cannot buy your peace. Living with anger and sadness and grief and all that it's just not worth it. It's not worth it.
And so I saw that you are starting training to become a doula.
Mhm.
I'm assuming that's as a result of your experience.
Yes, absolutely. Absolutely. I want to become a midwife. So I said I'll start off with a doula and childbirth educator, like work for a year or two, and then, go to classes and do what I have to do to become a midwife because I just want to be part of the very small percent that wants to change how birth is. I feel like so many doctors just want to induce, 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 like everybody in and out. Let's just get this done as fast as we can. But it's like, that's not how birth was supposed to be. Like women deserve to enjoy their labors, enjoy giving birth, like have that golden hour after their birth, not just be in and out as fast as they can and then wonder why everybody's getting postpartum depression and postpartum anxiety. Like I just want to be part that little percent that wants to encourage women to enjoy their labor and enjoy their birth and realize that it's not, pregnancy isn't a disease. Like our babies aren't diseases, they're people, and we should enjoy bringing them into the world.
Yeah, and then also providing that informed consent and options and
Yes.
risks and benefits and
Yes.
fully educating your clients versus just
Yes.
putting them through your standard policies.
Yeah, here, just take this because it's policy. Like, no, no, there's, so you don't have to just follow the policy. It's not a law. You can do, you can say no. And I definitely, yeah, I want to be part to change everything because it's scary.
Yeah, so we had some questions from Instagram. There were just two. One of them we already addressed was how you deal with the anger that comes from a traumatic event. But the other one was what advocacy work do you see yourself doing as a doula?
That's a really good question. Like when I'm done, I do want to create a website so that way I can, advocate that way. I want to offer free classes, free brochures, like anything to just help women to learn more about pregnancy and birth. And I want to continue to use social media. Um, I don't know. I haven't really thought about I can't even say the word right now. Why am I doing that? Okay, you know what I'm trying to say.
Advocacy.
I, that's it. That's it. That's the word.
Words
I
are
haven't
hard
really thought of
sometimes.
that. How I'm going to do that, but I know that when I'm like with a client, like I've already written so much about this. Like my instructor's like, Jesus, you've clearly thought about this a lot. I'm like, oh yes, I have. You have no idea how much I think about it. But like for my client, I'm not. I don't want to. I'm going to advocate for them. Like I'm going to make sure they know before they even go in to give birth. Like here is everything, all the risks and risks versus benefit with this drug, with this intervention, with this, with that. Like I want her to have all of the information. I want her to make sure that when she makes a decision for herself and her child, that she's going to have no regrets for it, that she has all the information. She sat down and thought about it and been like, okay, you know what? This is what I'm going to choose. And I have all this information and I'm not going to have any regrets for it. So I'm just going to make sure that all of my clients are fully informed, they're educated, they know that they will have me to be there for them. Like if they don't feel comfortable speaking up for themselves or they don't feel heard, like I will do that for them and I will have no problem doing that. So I want them to know that they will have nothing to worry about when I'm with them.
Do you feel like it's going to be difficult doing birth work while being a full-time caregiver for your daughter and then caring for your other children too? Or do you feel like you'll be able to kind of separate that out and use that as more motivation to do it?
Yeah, I don't feel like I'm gonna have any issues with it all. I like to involve my children in some of the stuff that I do. Like, my oldest daughter likes learning about Pitocin and birth and all that. Like, she loves it so much. Like, when I sit there and read about it, she's read all the books that I have. Like, she likes it. So I like to involve them in it. Because right after this happened, my daughter's birth, my middle child, Amelia, she's 6 now. She was so turned off at having kids. Like, she was so focused on making sure that when she was older, she never got pregnant. Like that's all she talked about for the longest time. She
Mm.
was like, we have to start now. Like I need to make sure that I never have a baby. Like I don't ever want to get pregnant. Like she was just so focused on it. So
Oh,
it was like, we have to find healthier ways around this, like to tell her that that's not how it's supposed to go. So I involve them a lot in like all the reading that I do, like all the videos I do, like all the research that I do. Um, so I would like to keep them involved. And then obviously, they're not going to come to the hospital for a
right.
birth or whatever. But yeah, I just want to keep them involved as much. And I feel like I'll be able to separate it in a healthy rate. Like I'm not going to take on like 15 different clients in a week.
Right, right.
Hopefully, being a doula, you can kind of make your own schedule and all that. So
Yeah, and what that brings it up, like what does your week usually look like with like Jolene and like her, like are you guys at the doctor quite a bit or like how often does she have to actually be out at appointments and stuff?
honestly, it's not that much. So she's homebound for school. So her teacher comes every Wednesday to do her schooling. So we don't have to leave the house Wednesday. We don't have to leave Thursday or Friday. Monday, she goes to speech therapy for 30 minutes. And then Tuesday, she goes to PT for an hour. And that's it. Everything else is just kind of, is mostly through Zoom. We do most of her appointments through Zoom. And then her specialist appointments are only once or twice a year. So we're really not going that much for her.
Okay, that's
Most
good.
of, yeah, so it's really not that bad. Like mostly when I'm busy with her, it's because like I like to work with her. Like I like to take her out and go here and go there, or like work with her on all of her goals and stuff like that. So her actual physical appointments, it's maybe 3 hours a week.
Okay. See, because a lot of people have the assumption that having a special needs child, you're just living at the doctor's pretty much. So
No,
yeah.
not at all. I mean, if you want to, I've seen some people that they definitely do. They're there for everything, but I'm more like more realistic. We don't need to go to the doctor for it. We're not going.
Yeah.
I'm going to do it at home. I don't like to just take her to the doctor for no reason.
Yeah. And
Sometimes,
just
I mean, sometimes you do. I'm sure kids like with heart issues kind of
right.
see the cardiologist more than other kids, but a lot of things people don't realize. Um, Being the caregiver, you're taught how to do certain things at home. So you don't have to go to the doctor all the time or the specialist all the time. You can do most of your visits through Zoom and then that's it.
How do you feel like this whole experience has changed your life overall? Like your mindset or like what you plan to do with your life or just how you feel about birth and things in general? Like how do you feel like overall it's just changed your life?
So like so many different ways. Before this, somebody just asked this the other day, but in a different way. Before Jolene's birth, I was so focused on like the future and my kids' futures and so focused on everything being perfect. Like the rooms couldn't look like they lived in it. There couldn't be a speck on the floor. Like everything had to be color coded. We had to get them straight A's because God forbid they don't get into like the best college and they needed to have their hair look perfect. Like everything had to be perfect and fast paced. Now it's a lot slower. Like I don't care about tomorrow. Let's make today count. I don't care that you have dirty underwear on the floor from a week ago. It's not going to hurt anything. If you want to color your hair bright red, I don't care. My son, he wants to wear Crocs to school. I used to make him wear sneakers. I'm like, wear them. Like so many things that I care about, I just don't care about anymore. Like I feel like I'm more present now for my kids than I was before because I was so focused on the future and things that really just truly didn't matter. And now I'm just more like, what can we do today to make sure that when you go to sleep tonight, you're happy with today? Like everything that happened, made you happy, and in that way they don't go to sleep like, oh my God, my mom yelled at me or my mom did this and that. I feel more present and I feel like I care. I don't feel like I care way less about things that just don't matter. If it doesn't directly impact my life, I don't care anymore. And definitely changed my outlook on birth. Like at first, after it first happened, I'm not gonna lie, like I hated doctors, I hated hospitals, I hated everything. Like I hated everybody and everything. But now like it just has opened my eyes to a whole world that I didn't know existed. Like I didn't know this whole medical mom world existed. I didn't know that we had to fight so hard for rights for our kids, for equipment for our kids. Like I didn't know we had to fight so hard for so many things. I didn't know that. And in the medical world too, like I didn't know so many things were like withheld from patients or so many accidents happened and all that. It really makes you stop and pause and dissect everything, everybody and everything, after you go through something like life threatening like that.
How do I have a VBAC? This is a question I get asked a lot. Women will message me and say, I know I want to have a VBAC, but I have no idea how to prepare or how to find the resources. Well, that's exactly why I created my first steps to VBAC guide. It's called Preparing for a VBAC, your first 3 steps to an empowered birth experience. This is the guide you need if you're thinking, I don't know how to go about finding a supportive provider, or I'm not sure how to understand or process my C-section experience. If you have had questions about these things and you're wondering if you're on the right track, then you need to download this guide. I want you to go to ebbandflowbirthco.com/first steps, all one word, FIRSTSTEPS, or click the link where you're listening to this episode now. I know that getting started with VBAC prep and finding support is something a lot of women are struggling with. And I want you to have a solid foundation for your VBAC prep journey because it doesn't have to be such a stressful process. So again, go to ebbandflowbirthco.com/first steps to grab this free guide today. Okay, so the last question I have is what would be your advice for either first-time moms or any mom in general who is preparing for pregnancy and birth? What would be your advice to her to kind of navigate things in a different way that the majority of women don't?
Get comfortable with advocating for yourself. Get comfortable with saying no. Get comfortable with asking for things. Don't feel threatened by a doctor. Don't feel like that they are above you because they are a doctor. And research everything. If your doctor tells you they want to give you aspirin because of A, B, and C, go home and just research it. Look at everything as a whole. Everything is a picture. I wish that I had read all of the childbirth books. I wish that I had read more stories, looked into everything more. Like I said, I didn't know anything. I wish that I had researched every drug, every intervention, asked my doctor for risk versus benefit with everything that they did. Just research everything, advocate for yourself, and get comfortable saying no. Don't feel bad if you don't want something done, but your doctor wants you to do something and you don't want it. Just say no. They can't force you to do something. I wish that I had advocated more for myself. So I always like preach out, advocate for yourself. If you don't want to, something doesn't feel right, don't do it. If you want something, feels like you should do it, ask for it.
Do you feel like because I'm the same way now that I had my first birth was traumatic, I researched everything, and a lot of people say, well, researching all of that just adds to my anxiety about the situation. Do you feel like the anxiety and just the constant researching kind of out the benefits of that outweighs like not knowing and then something happening and then trying to process it afterwards? Like, how do you feel like there's like a balance there between the research and the anxiety that can come from that and kind of obsessing over it and then not knowing what to expect or knowing the risks and benefits and just kind of going with it?
Yeah, you're right. Sometimes having all of the information in the wrong set of hands can do a whole lot of damage. So you have to find like your own kind of healthy balance. My daughter, for example, I just I'll just give you an example. So she was on this medication for seizures, right? And it was causing her some really strange side effects. So rather than just leaving it be and saying, screw it, let the doctors handle it, I don't feel like it was an okay thing. So I started researching it and I came across a couple things, side effects for the medication, some things that it could cause. So I asked the doctor about it, and I am glad that I did because she was able to go for lab results. She was able to get ultrasound, like she was able to get the things done to rule out all of these risk factors and then come off the med because it was causing it. Had I not looked up all those side effects and everything like that, she could have potentially suffered some liver damage, gone into liver failure. But because I looked it up, I potentially saved her liver. I got her all the testing, everything done. So you really just have to find a balance. Like you can research too much and then exhaust yourself or scare yourself. So it's best, like, if you're going to research it, just take some time here and there, research it, write down some things that you keep coming across. Obviously there's so many things on Google. You can't tell somebody only look at these two sites. They're going to look at everything. So I always say, like, take 5 sites, and if all 5 of those sites say 3 risk factors, 3 side effects, write them down, ask your doctor about it, get them to explain it. Like, research what you're coming up with more than just the random things that you
Yeah.
find on the internet.
And I
There's you
almost,
just find a healthy balance.
yeah, and I almost think that for me, looking at it with my clients or like personally, research the things you know you have a choice in, like you have control over.
Yeah.
So like Pitocin, like I have a choice to decline or accept the use of Pitocin. So maybe I should look at the research before I make that decision. But like things that you aren't going to have control over, like,
Yeah, no, don't ever
yeah.
research that. There's no point in scaring yourself over it. Like, if you don't. If you get diagnosed with, like, I'm going to use Jolene for example with the liver stuff, like liver failure and all that. I didn't even research it. Didn't even want to know where coming. I was like, we'll deal with that. Oh, if we get there, let's start at the tip of the iceberg first because we're not even there yet. We don't even know if we're there yet. Keep very slim. Like, don't dig
Mm.
too far into it.
And that's why for my clients, because there can be very heated opinions about whether or not to make a birth plan. And people are like, well, you can't plan for
Mhm.
birth. It just does what it wants to do. But I think not being so rigid in that plan. So like, okay, here's plan A. Like here, if everything went perfectly, here's how I'd want it to go. But here's plan B. If something else
Yeah,
changes, here's like the next option that I would want. Just so you feel like you still have some sense of control and some sense of choice over the matter. And
yeah.
that you know if something came up that's deviating from your plan, what would your next choice be? How would you want to handle that? So I always
Mhm.
recommend my clients make those plans. And even if you're a first-time mom, making a C-section plan just in case it does come to that, what would your
Mhm.
wishes be if something did happen? So yeah, I think there's a fine line
Yeah,
between obsessively researching and researching to the point where it's benefiting you.
I agree. And you're right. Only research the things that you have control over. If you don't have control over it, don't worry about it. Don't stress yourself out. Just research what you feel is important to you. And if it's not, then don't. I like birth plans too. I want to say that. I think that they're awesome. People are like birth plans. Like you said, you can't plan for birth. No, but you can have some wishes. If I want the temperature to be at 70, or I would like my purple blanket over the hospital blanket, or or I don't want this, or I do want this. Like it's just kind of a way to advocate for yourself on paper.
I've had, and it's funny because I have a lot of L&D nurse friends, and they say, oh, if you have a birth plan, like you're just basically walking yourself to the OR. And I think it's so funny. Like people have actually said that.
Oh my
And I think
gosh.
it's funny because with my first, I didn't make a birth plan and I ended up in the OR. With my second, I made very specific birth plans and plan A, B, C, D, and I did not end up in the OR. So I think it's just how you utilize that birth plan
Yeah.
and knowing and having a supportive team to support that birth plan.
Yes, and somebody to definitely advocate for you if you don't feel comfortable or you can't. Definitely, you got to have somebody put their foot down and speak your mind for you if you can't.
Do you have anything else you would like the listeners to know or to hear, anything before we wrap up?
Oh, I think we covered pretty much everything.
Well, thank you so much for being here. Where can people find you on social media? I know TikTok's your main place, but
Yeah, I love TikTok. That is my place. I don't know. I just can't steer away from it. I love it. I don't know. I feel like I'll never be able to switch. But I do have Facebook and my name on there is just Katie Spinks. It's a public account. It's a picture of me and my daughter. And then I'm also on TikTok as underscore K underscore Spinks underscore. It's just Katie and Jolene on there. Same picture, me and Jolene. It's the same picture on Facebook, Instagram, and TikTok. And then on Instagram, my name there is just Katie Spinks as well. It's the
okay.
same pretty much of all three.
Okay. Well, great. If you guys want to talk to Katie more about her story, or if you have a similar story, especially involving Pitocin or being a medical mom, that would be great to reach out to her and just build a sense of community around all of this.
Mm-hmm. Community is very important when you've been through birth trauma or you have a medical child.
All right, Katie, thank you so much for being here.
Of course. Thank you for having me.
You just finished another episode of Motherhood Flow. For more, head over to ebbandflowbirthco.com or on Instagram at ebbandflowbirthco. As a reminder, this podcast is provided to you for educational and entertainment purposes only. It is not a substitute for medical advice. Until next time, keep flowing.